Hello everyone and welcome to my channel. In today's video, we'll be discussing the PLAB 2 exam experience. And to that end, I have invited one of my colleagues. His name is Dr. Pranay. He has recently given his PLAB 2 exam just about a week ago in the month of May. And so we had a sort of discussion about that on Zoom. In the video, obviously we aren't discussing exact exam stations and scenarios because that's not allowed by GMC. But what we did do is talk about his preparation, his actual exam experience, how he felt in the exam, before the exam and after the exam, and also some tips and tricks that he used. And we also compared both of our experiences because the two of us went to the same college and we have a similar background in medical training, although he is a UK citizen. So he has a very unique perspective when it comes to the exam as well. I tried to keep the video as brief as possible, but unfortunately it's still about 40 to 50 minutes long. What I'm going to try and do is I'm going to timestamp different parts of the video so anybody can just skip to the part that they want to watch, which is most relevant to them, rather than watch the whole video itself because it is quite long and we try to go in depth about certain topics and issues. Okay, yeah. So Pranay, you gave the PLAB 2 exam on I think the 14th of May. I just want to know about your experience regarding the exam and how you went about studying for it, and just details like that. And since the two of us both went to the same college, we have the same, anybody else watching this an idea of what to expect, despite being the same exam. So could you just tell me a little bit more about your preparation? That might give the
Yeah, so my exam was scheduled for the 14th of May, and I guess I more or less started preparing properly for it 2 months beforehand. So I guess in the beginning of March.
Okay.
I didn't really know how to go about, really preparing for this kind of exam. It's quite subjective. The GMC advice as well is more towards just doing your own reading. But most people end up just going to the academies with online classes because of the pandemic. So, just seemed more convenient at the time, which is what many people were doing. I think it did perhaps, I wasn't paying a lot of attention in those classes because, 9 to 6 every day for like 12 days, it's quite demanding on your attention.
Yes.
So I don't know how much I actually did gain from the online classes, but it gave me an idea as to how to go about practicing.
Okay.
And after the classes, I did form a group to practice with. I think that's the most important thing, is just, going over stations, discussing the stations. And by stations, I mean the clinical cases, the scenarios that do tend to appear in the exam.
Okay.
So that's more or less what I did for the better part of 2 months, just going through stations with a few people that, I was comfortable with. So I think that was the bulk of my preparation. And we just talk about the stations at the end of each session, and just make our own notes as well. I think it's really important to, once you've done a station, just go over the notes you've made and also look up their, just look up their management on websites like patient.info or NICE CKS if it is accessible to you, because some of it is only limited to the United Kingdom.
That's right. Yeah.
So that really helps you out later on when you have these notes to just revise from.
Yeah.
Because while academies do provide you with notes and scripts as well, I think the management can change from time to time. So there might be some discrepancies that you could potentially miss just by relying on the scripts.
Right.
So so that was the bulk of my prep.
So you mentioned academies now, right? Now this is something everybody is so concerned about. I myself was, and like clearly you were also wondering about academies and preparing by the scripts, and the whole 9 to 6 thing where they just coach you every day. So how do you feel about the academies now? So now that you're done with the exam and you're still waiting for the results, I know, so you don't know exactly how you did, but since you and I have practiced a little bit as well, I have a fair idea of how you may have done, and I feel like you probably would have passed. So based on that assumption, You never know until you get the result. But based on that assumption,
Yeah,
let's
I
just
mean, I wish you
say
hadn't said that, because if the contrary happens, then
it's the same.
yeah.
No, it's the same. Everybody told me the same thing. Like I'm going to pass, and I was just freaking out until I got the results. So I know you're feeling the same way, but I think we should just be optimistic about it until the results actually come out. But yeah, like I was saying,
Yeah.
how do you feel about the academies now that you're done with the exam? Do you feel they helped? Would you say you need an academy to pass?
Well, I guess it depends on the type of person you are. I'm not particularly outgoing when it does come to studying on my own. I do like having, I like being told what to do, being given some instructions as to what I should be doing.
Right.
So in a way, going to an academy did work for me, because it sort of, it introduced me to all the things I should be doing. In addition to that, you do have resources as well that the academy can provide to you. They do compile any new, if there is a certain trend in perhaps a type of station that is coming up, they do sort of tailor their approach to preparing you for it. And in addition to that, you do come across people who do have a similar exam date.
Exactly. Yes.
And if you are looking for potential practice partners or anyone to, sort of run through things in the approach to the exam, then that really helps, and that's something an academy would facilitate.
Right.
In addition to that, you end up interacting with some of the teachers who have also, taken the exam as well, and could also potentially advise you on how to study and what you should be doing. So there's a great deal of guidance that is provided for those who do need it. Not everyone would need it. Some people are comfortable doing their own thing, but I'm the sort of person who needs guidance. Yeah.
Okay. So you and I are similar in that way, because I had to prepare twice for the exam. So mine was cancelled last March because of COVID. So preparing twice just means you need to just be more efficient in the way you study. Otherwise, you're just going to burn yourself out that way. And I feel the first time I went to the academy as well, and pretty much I feel the same way you do about this, that you get to meet people to practice with. You get to interact with them and start practicing early on as well. You have access to all their materials and their resources. So, for example, the examination stations, procedure stations, simman stations, they have all of those resources in the academy, right? So you can practice on mannequins and you can practice with the simman, etc. So those, I would agree, are like very, very good advantages to the academy. The only issue I found was people becoming scripted, because you have access to those scripts. Now, I think the scripts are actually a very good thing, because everybody's on a level playing field over there. But I have noticed that people who just end up depending on the scripts and don't go about the stations their own way, they tend to not do so well in the exam. So that's what I've seen from practice sessions and from the actual exam results as well. So what do you feel about the scripts?
Again, I feel like the scripts are a really good thing when used the right way. You do avoid having to, go through other material. They save you from having to go through, textbooks.
All those textbooks and guidelines.
Through. Right, so they do cut out a lot of the work in that way as well. I would never really use them as a complete script, just acknowledge the points that they were making and just use it as maybe a guide as to how to go about any sort of consultation.
Yes.
But I did find myself becoming scripted at times, and I hope I didn't appear to be scripted during the exam, but there were a few stations where I did feel like perhaps I was.
Okay.
So I can't reiterate enough how important it is to do your own thing as well.
Absolutely.
Scripts are just a guide. They are a guide as to how you would approach certain stations, how you would treat certain conditions, but I think in my experience at the academy too, I did feel like people were becoming very scripted, and especially with the mocks as well. I think everyone needs to bear in mind that you're not going to have enough time to say everything that is in the script, and that was a mistake I felt that we had made when I was practicing with my group. We did sort of pick out the fact that somebody had missed a certain differential, a certain question, when essentially in the mock or exam itself, you're not going to have time to go through everything.
Right.
Like, you need to actually train yourself to ask the pertinent questions. And
exactly. Yes. So
leave out.
if you end up asking all these questions in the script, you're just not going to have enough time. So you need to
you
go
run
about
out
the
of
station
time.
your way. You
Yeah.
need to figure out what's relevant to that situation, because the
Right.
scenarios keep
So
changing, right? They change with every day and every station these days. So if you're going to be scripted, you're not going to be answering the questions that the examiner
yeah,
or
and
the
they change, and your simulator is different. You could have a simulator who is, not a very
cooperative.
he's a slow speaker
Right.
or is a bit difficult. So if you're going to
Exactly.
just rely on the script, then you're screwed in a way because you won't get to your diagnosis or, to the management. And
Definitely.
that's what happened to me. Like
Definitely.
that happened to me for like a station that I knew quite well. I made the mistake of being scripted, and
Okay.
I just got to the diagnosis. So yeah, just don't do that. Like be mindful of how much is necessary. Um,
Okay.
yeah, and also it's just that you need to respond to almost every
Concern.
direction that a patient gives you, that you need to respond to it. I don't think that's necessary. I think as long as you're natural with your responses, a normal conversation isn't going to have someone, responding to every point that you make. Sometimes it's just best to listen, just say okay, and just move on.
Right.
Whereas I felt like in the academy, they were like, people were saying, "Oh, I'm so sorry to hear that." Almost everything, and it's just like it's not needed. And if you say it too many times, it comes across as really
That specific
generous.
point, right? So that's
Yeah.
another way of being scripted, right? It's not just the medical content. It's also these memorized lines and memorized phrases that people tend to use, which are completely unnecessary. So one of the most common ones is, as you said, "I'm so sorry to hear that." Now so many of us have just learned that from the academy, and to be honest, it is a good thing to say, and especially it's a good thing to say, especially if you mean it, right? If you mean that you are actually sorry to hear that this person is in pain or has had something bad happen to them. But then if you're going to keep repeating that, it just dilutes the value of that phrase. So somebody says, okay, I'm here with a cough, I'm so sorry to hear that. And my chest hurts a little bit, I'm so sorry to hear
So
that.
it kind
So
of
the repetitiveness
yeah.
is very, very counterproductive, in the exam, I feel.
Yeah, plus like if someone just comes in there with a cough, like I'm so sorry to hear that. Like a cough isn't a big deal.
Exactly. Yeah,
It's
exactly.
like if you had like an interaction with your friend and they come and see you and they're like, oh, I've been feeling a bit, been having this cough. You're not going to say, I'm so sorry to hear
Exactly.
that.
You
You're
just be
just
like,
going to be
okay,
like,
fine.
yeah, yeah.
Exactly. So,
So
so
it
speaking
does take
about
away in a
being
way.
natural, right? Here's another factor in that uh, is the fact that people feel like they're in an exam. They feel like they're interacting with these simulators who are not real. So it makes it more difficult to. These simulators are not real patients. So it makes it more difficult for you to behave as you would normally do as a real doctor, right? So, with that in mind,
Yeah.
so how do you feel these simulators are when in the context of the NHS, do they act well enough to be seen as real patients? I definitely feel so, because when I did my attachment, all the patients I interacted with were just like the simulators. I felt they were so realistic, and I felt that the exam actually gave me a sort of head start in interacting with them and dealing with patients in the NHS. So I was just wondering what your thoughts about that were.
Well, I haven't done an attachment, so
Right. So you're a UK citizen though, and you were sort of brought up there, so you have a good idea of
yeah,
how to interact and
putting it out there.
yeah,
Yeah,
you do have an
okay,
idea of
yeah.
how to interact and how to and what to expect from people over there, right? So most of us haven't had that much interaction with people from the UK. Now, would you feel that these simulators are a good representative of what to expect from patients in the NHS?
Yeah, so I think they were to an extent. I do believe that maybe with live simulators, because obviously they are trying to sort of, include every possible scenario.
Right.
So you will have some patients behaving in, there could be difficult simulators as well. But on the whole, especially with the telephone conversations, I felt they were very, very accurate.
Right.
With the way they represented
Right.
how the locals are, yeah.
Okay. Interesting. Okay. So we had spoken before actually. So we spoke before about how your exam went and sort of some of the experiences you had.
Yeah.
So I thought we'd go into that as well. But before we get into that, your main concern. So your main concern before the exam and when we were practicing as well was time management, right?
Mm-hmm.
So
Yeah.
do you feel you were able to tackle that aspect of the exam, the time management aspect? And if you were, then what did you do, and what are some tips you could give people to improve their time management?
Yeah, well, I felt like towards the end, I was really trying to cut down um, and try and finish cases in the 8 minutes, because I realized that my time management was the biggest thing holding me back. I don't know if that was perhaps a bit too late for me, but yeah, I mean, there are many ways in which I was wasting time. Primarily, I was, taking too much, doing too much data gathering.
Right.
So I was trying at the end to try and ask relevant questions and leave out irrelevant questions. Like, if you had more time, then yes, it would be nice to try and cover and touch on each and every aspect. But again, I think a problem with the scripts, with an element of the teaching and the academies as well, and the mocks, is that there is so much stress on you covering, like, taking the history, taking the whole, medical history, allergies, family history, travel, etc. You won't have time to do that. And
with all that going through your head, it's tougher to focus on what's happening in the now, right?
And it's just a waste of time. Like, you're wasting these precious, seconds on these irrelevant questions.
Right.
But that is something you need to start training yourself towards not doing.
Right.
Which I think, unfortunately for me, happened a bit late. Yeah. So again, data gathering is a really important thing to sort of know what to ask, what not to ask.
Yeah. So the irrelevant questions and things like that. So that's something everybody ends up tackling sooner or later. But one point I want to stress is that people do end up focusing on the scripts, and that script, not even the script, the general structure of history taking. It's there. I feel like it's there just to be a good outline and to be a guide for the sort of questions you need to ask. So the problem comes when, for example, you get an elderly patient, like a 90-year-old man or something, and then you end up asking him about his occupational history and his sexual history and things like that. It's just going to be a huge waste of time. It's irrelevant. So I think things like that should be avoided, and it's a good lesson to learn sooner rather than later, because you can focus. Okay, and so how did you end up figuring out the whole time management issue?
I think because people just told me, you take too long. You take too long. I wasn't finishing my mocks on time. I was able to get to the management, but I couldn't do justice to the management.
Right.
And yeah, I think in general, when I was practicing with my group as well, I think other people would start to finish on time or get through most of the station on time, and I would still be on, part of the history when the bell would ring. Right. So I think another good piece of advice is, when you are practicing with your friends, just be strict, just start timing, 4 minutes, finish off the history, start timing as early as possible. I know at the beginning it could seem tempting to just think like, oh, it's fine, or start timing things a bit later, but no, just do it from the beginning. Yeah,
practice as though you're in the real exam scenario from day one, right? So that's the same thing I say. When you start practicing, the exam scenario is such that when you enter the room, you have to say your name, you have to say your GMC number, and then you can start the station. I advise everybody to just start practicing that way from day one, because at the last minute, if you try and remember your GMC number and things like that, when you go into the station, you may become confused, you may forget. I know someone who forgot to say their name and GMC number when they went into the station, and midway through the history taking, the examiner interrupted them and asked them for their name and GMC number, and that completely threw them off that station, and they ended up failing that station just because of that. Oh, okay. So I think, practicing as though it's the real exam scenario from day one is very important. That's a good point you brought up. So the time management thing, I understand. So it's just practice makes perfect over there, right? The more you practice, the more you figure out how to handle it.
Yeah, I mean, practice is good, but at the same time, just read about it after you're done practicing, so you don't forget. Right. So I think a lot of people that I was sort of meeting, everyone is struggling to remember the management. Right. So I think a really good way of just reinforcing that in your head is to just go over the cases that you've just practiced in your practice session. Just quickly, just brush through them, just look at the management, and hopefully like most of it will remain in your head. So you don't need to worry about that for later.
Right, makes sense.
Yeah.
Makes sense, yeah. So while you're practicing, you get an idea of what the management is, and then it just comes more naturally the next time. Yes. Good.
Yeah. It just takes like an hour just to go through. I don't know how many cases people usually practice. I was doing about 10 to 12 a day.
Right.
But like 10 to 12 a day is actually really good if you're in a group of like 3 or 4.
Right.
It's, enough to get through the bundle of cases everyone gets sent.
I was practicing with
Also, I would advise not to wait until you attended the live classes.
Right.
I think some people were waiting to attend the live class first before they went through the stations.
Okay.
So I would go through the stations as soon as I was comfortable. Like, just if you're going to attend the online class, then attend that and then start going through the stations. Or if you're only going to go to the live class, then just have a read through, just become familiar and comfortable.
Yeah, so I agree with that as well. So
yeah.
If your exam's far away and you're still a bit worried about it, you want to start practicing as soon as possible, the simplest thing to do is at least go through all the scripts so you have an idea of what to expect. You don't need to join the academy right away. You can just start finding practice partners to practice with. And some of these people, they may have not passed the exam in the first go, so they will have exam experience and they'll be really good to practice with. Some people have been practicing for a couple of months and the exam is still a little bit far away, so you'll be able to get an idea from practicing with these people. And you can also join the academy early if you want to join an academy. Go through the online classes. Later on, you may end up going for the in-person classes as well, and that'll give you a very good idea of how to go about practicing and everything, like way before your exam or way before you're actually planning to go to the academy in person.
Don't start practicing too early either, because it just gets boring and it stagnates. Like,
it's a fine line.
That's not good either.
So
I think a good benchmark is like 2 to 3 months.
Yeah, I only know one person who practiced for about 3 months. But apart from that, most people I know were about 4 to 8 weeks. This time I practiced for just 4 weeks because I had practiced prior to that as well. And by the end of 4 weeks, I was already sort of getting tired of it. I was already getting sick of practicing so many hours every day. So
and ultimately, like, no matter how much you practice, it's just going to be your performance in that one session. It's like, it's also an exam that you can't really be ready for. Like, no one ever feels very ready. And
to be honest, once you get out of the exam, it's like nothing you've ever gone through before. This is the most unusual exam I've ever been part of. Even though it's like an OSCE based exam, I've never ever been in an exam like this one. And I don't know, I just felt it was a very good experience overall. Especially once you pass, you feel it's a very good experience. But
once you pass, it's a great experience. But like when you're, I mean, I don't know how you felt, but when I was going through it, I felt awful. I was just like, halfway through, I thought I was like, you've messed it up. You're like, I told you this already. Like halfway through, I was like, okay, you're failing this. And then somehow I just, composed myself and just did the remaining stations. And and then when I walked out, and then I just sort of rehashed it in my head. I was like, okay, it wasn't as bad as how you thought it went, but still, like, there are many things that I would have done better if I could. Like, I would still.
There's always so many things you can think of, after the fact, like so many mistakes you've made, so many.
Because you can prepare yourself so much and be like, okay, I'm going to say this, I'm going to be like that, and then ultimately, when you're in the exam, you just go back to your core instincts, and many things just don't matter. You just end up doing something else. It's a bit of a shock, to be honest.
You were talking about in the middle of the exam, something didn't go your way. You thought something may have gotten screwed up, and that sort of threw you off. But after that, you thought, okay, screw it, I'm going to fail anyway. So might as well just, give it my all and see what happens, right?
Yes.
So that's sort of the advice I've been hearing from many people, even at the academy. People have said the same thing. If you feel like you've screwed up a lot, don't worry about it. Don't get anxious about it. Just like forget about the exam. Just assume you're going to fail and then just give it your best effort anyway. Is that what you ended up doing?
Yeah, that's what I ended up doing. I had a good start. I had a good couple of first few cases and then some pretty bad ones.
Sort of the same thing happened to me. First couple of cases were good, decent, like the simulators were cooperative and everything, and then after that, I think after my first examination station, it just started going downhill. But then
I don't know. I think our version of decent may vary. and our versions of bad might vary too.
That's possible, but right after the exam, I was just assuming
Yeah.
I'm going to fail at least 4 or 5 stations.
I'm thinking that you may pass.
Yeah.
Yeah.
No, I'm
so
telling
it's-
you, you'll probably do fine. Don't worry about that. We sort of discussed those stations, which didn't go so well for you. Obviously, we can't go into it in detail because that's just not allowed. But we can just talk about your experience.
Yeah.
So, for example, one of these stations, it turned out to be. So you thought it was a breaking bad news station. You thought you would have to break bad news to this patient, but it ended up being something else. So how did you figure that out? How did you sort of recover from that misconception? And then how do you feel the station went?
Okay, so it's all a bit hazy. So I'm not sure in what
But
order
it was
things
just a few days
exactly
ago.
happened.
It shouldn't be that hazy.
Well, yeah, I know it was just a few days ago, but it was a. I don't want to say it was a traumatic event, but it wasn't a particularly nice event.
Having PTSD. Okay.
Yeah. I think the station beforehand didn't go very well, so I think that affected me to an extent. So when I was reading the brief, it did take me a bit of a while to understand what was expected from me. My initial impression was that it was a Breaking Bad News case, and that was what I had in my head when I went to the station.
Right.
And yeah, I don't know, something still didn't sit very well with me. I reread the brief a couple of times before going in, and I just couldn't place I didn't really know what they wanted me to do, actually. I was just assuming it was a Breaking Bad News, but I was actually confused. So I went in and I just started talking to the patient, trying to figure out what they knew as well. And I don't know, I just felt like I was being given hints that they already knew about their diagnosis. And yeah, so I mean, I still ultimately sort of began to set up asking, I just began to set up the Breaking Bad News setting. I was like, oh, is there anyone here with you?
So this is you being in that scripted mindset at that point.
I was priming her for the bad news, but then for some reason I decided to just quickly reread the brief. And then I felt like it wasn't Breaking Bad News. I felt like she already knew about her diagnosis, and it was actually a counseling station.
Two good points there is one of them is you need to read the station very importantly, and you shouldn't feel there should be no reservations about reading the station in the actual exam itself. Like while you're in that room, you shouldn't feel worried about rereading the station, because they say like on the GMC guidelines, they're not going to penalize you for that. So if you feel like you don't know something, definitely read the station. And the second point would be go with your instincts as well, right? Because you felt something was wrong, there was some alarm bells going off in your head, and you went with your instincts and you decided to go for that. So if you were scripted, if you were just going to go along with the script, it probably wouldn't have gone so well, right? And yeah, so you were saying it turned out to be a counseling station.
Yeah, I mean, those points are all quite valid, but there also is that super added element of you being very nervous as well. And when you're nervous, you don't perform at your best when you're nervous.
Definitely.
So maybe if I wasn't as nervous as I was, then perhaps I would have just done the case as a counseling station in its entirety. But yeah, I mean, I just did a complete 180 and started counseling instead. And started to explore. I was just more or less riffing off of what the patient was saying to me.
Right. So exactly. So you went with what the scenario was asking you, not with what you were expecting from the patient or from that scenario, what you were thinking of from the script. You just went with the flow, and it worked out well for you in the end, right?
Well, I don't know if it worked out.
I mean, it worked out better than
one can only hope that it worked out well. I still wasn't really done when the bell rang, but I think I covered something at least, something to get some marks. But yeah, I don't know if it worked out well or not. I have no idea. So
yeah, in that sense, I myself feel it's not a big deal if you don't finish the station completely, as long as you've covered the broad points that need to be addressed. Even they know it's just an exam per scenario, so you don't have to go over everything. As long as you cover the main points, I think you should be fine. So another one you were telling me about was your examination station. So you felt that one went poorly. I don't know, you were feeling a bit worried about that, but then right after that you just rallied and thought, okay, forget about the previous station, let's just move on and think about what's going to happen with the next station, right? But let's just go into that a little bit. What happened with that examination station? Okay, so yeah, you had a bit of a change of venue because I think it was getting a bit dark inside. So I just wanted to address that in case anybody's confused while watching. It was getting dark inside, so he had to move
Yes, I
outside.
went outside.
But I wonder what you're
Welcome
gonna
to my
do.
garden.
I wonder what you're gonna do when it gets dark outside, though. So,
Oh, it's summertime, so we've got
oh,
a good like 2 hours before it gets dark.
wait. So, what time is it there?
Is it going to take this long? Like 2 hours?
No, hopefully not. No, we'll end up boring everyone. But okay, so
Yeah.
now that we've addressed your change of venue,
Yeah, so it was an examination station. I actually went in thinking it would be a pretty simple examination just based on the brief, on the history on the brief. So I went in feeling good about it because I knew what I had to do. However, when I went in and saw what they had put out and then started taking history from the simulator, this was a live simulator. I realized that it was, something else entirely. I did my best to take a short history. Before walking in, when I read the brief, it did seem quite kind of obvious to me what the station was going to be. I already had in mind what I was going to do, what I was going to ask. And yeah, I mean, I thought I knew what examination was coming as well.
right?
But then upon entering, there was a completely different set of equipment. As soon as I started taking history, I just knew I had to, wrap it up and get to it really quickly because there was some urgency in the station. I think I did have about 4 minutes left to actually do the examination. There was also an examiner sitting in the room with me as well.
Right.
But I just stumbled, lots of fumbles as well. I didn't even get halfway through the examination.
Right.
I don't know. I mean, I know why. I think you just need to become really adept at opening packaging, perhaps. I don't know if that's I feel like that's kind of where a lot of time went with just orienting myself to the layout of where things were and just preparing things that need to be prepared before I could even start the examination.
Right. So now that things didn't go your way. So what happened after the station? How did you move on from that experience and then just continue going about the following stations like brand new? What had happened? You just ignored that and moved on. How did you go about that?
If I'm being honest, at that point that was probably my worst station.
Okay.
So by then I was just like, you're going to fail. It was kind of like I didn't have anything else to lose. So I just went with that attitude. Stations afterwards were better. So that's all I can say you can do. I just made peace with the fact that I was probably going to fail at that point. And I just accepted what the reality was at that point, and that nothing that I could do with this moment could, change anything.
Right.
I honestly just wanted to get through the exam and just be done with it. And thankfully, the cases after were much better. So the important thing is to not think about it. And honestly, when the bell rang and I couldn't finish, I was just unbothered. I was just like fine, and I just thanked them and I just left the room.
This is pretty good advice for anybody to follow in case, if a station doesn't go well, it's not the end of the world because you have many other stations to make up for it. And who knows, you never know until you get the results, because even if you think a station went so bad that you're going to fail, if you feel like you've made some gross mistakes and stuff like that, you may still end up passing the station. So I know you feel that way about this one. We'll find out soon enough, in another 2 or 3 weeks maybe, when your result comes out. But in my case, I had a similar experience with my first examination station. So I had 2 or 3 normal stations, and right after that was my examination station, and it was my first one of the day. And everything I had practiced just completely went out of my head, So the way we have to explain the examinations, greet the patient, introduce yourself, explain the procedure, talk about any possible pain they're going to experience, their position, all of that stuff, it just went out of my head, and I ended up taking a brief history. I ended up just asking for consent and going ahead with the examination. And I was so sure I was going to fail because I felt I got the diagnosis wrong as well. But in the end, I ended up passing that station. I don't think I did particularly well in that station, but I ended up passing the station nonetheless. So worrying or getting too anxious about a station not going well can only be detrimental to, how those following stations end up going. So that's a good takeaway point there.
Yeah, and I think again, the importance of a brief history for examination stations, like never fall into the trap of asking too many questions.
Absolutely. If it's just an examination or just a procedure station, maybe you can have a minute.
Yeah.
You can take a little bit of time in those situations. Rule out the obvious thing, yeah. I had combined stations, so both of my examinations were combined stations, and they were a bit lengthy as well. So I ended up taking as quick a history as possible. I needed to get those relevant points, so I couldn't have shortened it down at all. I think I ended up taking maybe 3 minutes for each of the histories. The examination took another 3 or 4 minutes or so, and after that, the management was just a minute, where I just rushed through the red flags, the safety netting, the follow-up. I just rushed through that, and then I tried to give them a broad outline of the management moving forward in that 1 minute. And like I said, I did end up passing these stations, but keeping the history brief is a very, very good idea and a very good way to go about examination stations in general. Anything you'd like to add about that? You were sort of expecting the examiner to give you an answer or give you some sort of advice at that point, like when things weren't going too well. So what exactly happened there?
Well, I think there's one thing that you need to remember is that people doing mock simulators or people doing the stations would try and prompt you. They would sort of help you out along the way.
Absolutely.
So maybe you do become used to that. So when it doesn't happen in the real thing, you are sort of wondering, like, why aren't they doing the same? Why you sort of just out of habit look to the examiner to see if they would sort of intervene or like help you out. I mean, I didn't do that myself, to be honest. I think from the onset when I walked in, I kind of gleaned that the examiner was.
Yeah, you just broke up there. I think what you were saying was you gleaned that the examiner wasn't going to help that much, right?
Expecting help when things went wrong. But what they will do is they will step in if they feel like you've just gone completely off course.
Right.
I have heard that they do kind of just tell you what,
they give you
just nudge you back into what you should be doing.
Exactly.
But yeah, but at the very most, that's it. That's all. Like
exactly. Yeah. So
you can't expect anything more than that.
In another my second examination station, I was when I went in, the examiner had said something. Again, when I was going to do the examination, I think there were some tissues over there. I just went to take them to sanitize, and the examiner spoke to me at that point and said, "It's okay. You don't need to clean it. We've already cleaned it before you entered." So I said, "Okay, fine. Maybe he may be slightly more helpful, in case I need to ask him something in the exam." But the thing to remember is they're here to examine you, and they just have to pretend that they're not there. Because later on, I was trying to move the mannequin for something, and I looked at the examiner and I asked him, "Am I allowed to move the mannequin?" And he just stared at me with a completely blank face, just stared at me for about 5 seconds or so, and I was just like looking back at him, confused, hoping he would say something, but no.
Yeah.
Unless they really, really have to, they will not say anything. So do not expect any help from them. Even if a station is going wrong, don't expect any help. If they do help you, you're lucky. One of these stations, you said you couldn't get the diagnosis right. And I know this happened to a friend of mine as well. So I thought we could talk about that too.
Yeah, I mean, I think I wouldn't just say one station. I'd say maybe 2 or 3. I wasn't really sure of the diagnosis. And that's another thing that's really important to bear in mind. It's fine if you can't diagnose, because as an F2, you're actually not supposed to be diagnosing anything, really. You're sort of working up patients.
Right.
And then you're going to review them anyway with your seniors. So that's, again, something else I feel like many of us are sort of, I wouldn't say misled, but we're encouraged to, provide a diagnosis in all of the stations. It's not necessary. It's fine to say that, you have these findings, but I can't be sure. Escalate. You'll have someone else come and have a look at them.
Definitely.
And you can just address the concerns that they have at the moment. So if they are in pain, you can provide them with some pain management. You just reassure them.
Figure out what you can do for them.
Yeah.
Taking up the consultant's role, right?
Yeah, precisely.
So, like I said before, a friend of mine, he ended up passing the exam too. He had a station and it was an examination and a procedure station. So he ended up doing the examination. He was not able to figure out the diagnosis at all. He had no idea what he was looking at. So he just straight up said, "I'm very sorry, I don't know what the diagnosis is, but what I'm going to do is I'm going to have a word with my seniors so they can come and have a look at you, because I don't want to give you the wrong information. And once we know for sure what it is, we'll be able to figure out a management plan for you." He ended up passing this station as well. He thought he wouldn't pass because he didn't get the diagnosis right. The exact same thing you're saying, where they encourage you to tell the diagnosis. Now, what he did was perfect, because he admitted he didn't know it. He said that he would get help to get the right diagnosis, rather than giving the wrong diagnosis there, and that would just be detrimental to the patient. So yeah, that's a very important point. Do not be afraid to admit you don't know something and ask for help, right?
Yeah.
Is there anything else you'd like to add, just generally about your exam experience?
I mean, well, I think I wish I hadn't stressed as much as I had stressed in the last few days. it felt really unnecessary, especially
Right.
when what it ultimately did come down to, it wasn't because I didn't know enough.
Right.
Like, it's just how you react in those
In those situations.
situations,
Yeah.
how you respond.
Right.
So yeah, again, I would really caution anyone from just trying to learn and cover too much in the last 2 days. I think instead of that, just I think instead of that, just practice with your friends, practice some stations.
Absolutely.
Try and practice where you're not following the scripts, so
Right.
you're coming up with your own responses.
Right.
While many of the stations were familiar to me, they did have their own twists.
Right.
And again, when you're actually in the exam, it's a completely different environment, a different feeling. And the mocks that I did were only like a maximum of 8 stations, whereas this is 16.
Okay. Yeah.
With 2 rest stations.
Right.
Yeah, they do sort of make you sort of stew in the waiting room as well. You don't start immediately.
I didn't find the waiting room too bad
for a while.
I just ended up. I just ended up chatting with someone. I had some coffee. I had a biscuit. The waiting room was fine for me.
We just sat in silence, and eventually, like, your thoughts start racing, and it took a really long time.
No, I was just super.
So just to be calm there.
Yeah, I think maybe that's just how I am. I was just like,
well, that's just how you are. I think, yeah.
Okay, so we pretty much covered whatever we wanted to talk about. So just to conclude, what would be some of your tips? I think we could just go through 2 or 3, main tips that people should take home with them while preparing for the exam. Well, give me your top 3.
It's good to actually. I mean, for me, it's always make sure that you make your notes while you're practicing stations. Go over them again.
Right. So
I wish I made better notes.
With that point, I find that whenever you're practicing with someone should always be, even if it's the person pretending to be the simulator or the examiner, whoever it is, somebody should be writing down those notes and points, while practicing, because when you're practicing, you may remember, you may think, okay, this person said something wrong. Okay, no, this is where he should improve. But then in the end, you just end up forgetting a few of those points, and having them written down gives you an idea of the trend, that you're going through in those couple of weeks of practice. You can see where you're improving and which areas you're still lagging in. So if you want to make notes about yourself, definitely do that. And the other people who are giving you feedback should be writing down notes, because it will give you better information about how to improve. So I think writing down the notes.
At the same time, I do think it's good that you do make some of your own notes, because there are certain things that you are going to miss out, and certain points that are specific to you.
Right.
I wish I was a bit more proactive that way. Other than that, I mean, I think it's actually a really good idea to go to the academy a couple of weeks before your exam.
Okay.
Because you just meet new people to practice with, to sort of with. It's also sort of an eye-opener as well, because I admittedly I wasn't taking it very, very seriously until I finally went to the academy, and I realized, like, okay, I need to be doing things a bit differently, doing other things as well. Like, it's an eye-opener.
Definitely. So it was the same thing with me.
I would always recommend going to the academy, like,
or at least joining the online classes or practicing with people online. If you're not going for the academy, at least do that.
Yeah, some of your own notes, because there are certain things that you are going to miss out, and certain points that are specific to you as well.
Right.
So I wish I was a bit more proactive that way. Other than that, I mean, I think it's actually a really good idea to go to the academy a couple of weeks before your exam.
Okay.
Because you just meet new people to practice with, to sort of with.
Right.
It's also sort of an eye-opener as well, because I admittedly I wasn't taking it very, very seriously until I finally went to the academy, and I realized, like, okay, I need to be doing things a bit differently, doing other things as well. Like, it's an eye-opener.
Definitely. So it was the same thing with me.
So I would always recommend going to the academy, like,
or at least joining the online classes or practicing with people online. If you're not going for the academy, at least do that.
Yeah, I mean, to be honest, the online classes, again, like, for me, it was just I didn't pay attention in half of them. Like, it's a big ask, and if I'm being honest, they are taught in a, like, I don't know if it's the right word, but they are taught in a very Indian way. Like, you're just talked at.
Okay.
And there is a lot of variance as well. It depends on the teachers who are teaching at the time.
Yes.
So the teachers that you could have for your group could be different to the teachers that you have for.
Very true. Very
So
true.
some teachers are really good,
Yeah.
and others probably aren't the best teachers. So there is that whole element as well. So if you do take online classes, then consider just, coming in and just sitting in a few of the live classes and see if they make any difference to you.
Exactly. Yes.
Like some people,
I know some people who've done that.
For some people don't.
Yeah.
So there is.
So yeah, second point would be practice makes perfect. Make sure you practice enough. Okay.
Yeah, I guess. Yeah, just do mocks. Just mocks.
Right.
Yeah, mocks are a lot of things, but coming down to it, yes, they are helpful. So do your mocks and do them early enough so you can make improvements.
What my advice would be regarding mocks is you should do mocks, but don't take them too much to heart. Especially if a mock doesn't go well, because the main thing to remember is these people who are taking your mocks, they're just people who pass the exam. They're not real simulators. They're not real examiners. They're
not actual examiners, and many of them are just marking script.
Yeah, it gives you good preparation to be in that exam environment, because they do 8, 10, 12 stations at a go, so you'll be mentally prepared for that sort of strain. Mocks are
we just said 8, but yeah.
And
you get some feedback and any.
Yeah, definitely. But I find the feedback to be a bit repetitive also. Like they're generally very obsessed with ICE. I know ICE is a very helpful tool, but it shouldn't be used constantly. You shouldn't keep asking the patient, ideas, concerns, expectations all the time. Use it once or twice, or don't use it at all, or use it when it's relevant, or just use certain aspects of it which you feel are useful. Because for me personally, ICE backfired on me in the exam. When I asked ideas, I said I asked one of the patients. So I know you've told me about this, about these symptoms you're having, and the general story you're telling me makes me feel as though something deeper may be going on here, something in the background. So do you have any idea what might be going on with you? And he just said, no, doctor, isn't that why I came to you? So that sort of backfired on me. And I feel like asking ICE is good, but definitely use it in the right context, in the right situation. I just ended up asking people their concerns more than I forgot about the whole ICE aspect. I just asked them their concerns, and that worked out very well for me in the exam.
Yeah. Yeah, I agree.
So lastly, let's finish up. The last thing I wanted to know is, what would you do differently now? So now that you've gone through the exam, with your preparation, what would you have done differently, or what would you have done differently in the exam?
Yeah, I guess I would have taken it more seriously earlier on.
Okay.
There's always this grace period between passing PLAB 1 and starting your prep for PLAB 2. Or even in the early stages of preparing for PLAB 2, you sort of slack off, which is what I did to an extent. And again, I should have been more strict with timing myself when practicing, from the get-go.
Right.
That is something I really wish I should have, I should have done far earlier.
Right.
Because I was still having issues right to the end.
Right.
And I think maybe I should have just come to the. This is just me personally, because other people might feel differently. But I think I should have just gone to the academy a month beforehand and just practiced there.
Right.
As opposed to being at home, because when I was there, I had a routine. I was waking up early. I was going to the academy. I was there for most of the day.
Right.
And I was getting the hours in.
It put you in that mindset.
Things.
Yeah, exactly.
So when you're at home, you're sort of liable to a lot of distractions. So.
So same story with me. I wasted a lot of time before PLAB 2 because, well, one thing was because I had that huge delay because of COVID. So it was what was it, maybe 9 to 10 months or so. I had to wait to retake PLAB 2, and I had to start studying again from scratch. So I just really wasn't in that mindset. But then when I actually went there, I started preparing from maybe 2 or 3 days in after I settled in a bit. I started preparing right away, and that made all the difference really, because. The one thing I would have done differently would be I would have gone through the scripts maybe a month earlier. I would have just gone through the scripts, had a broad idea of what how to go about doing the stations and everything, and then started practicing with everybody. I feel like that would have been much more productive, and I probably would have had a better time in the exam too. Like I would have been less anxious. Yeah, that's my
Yeah,
two
well,
cents.
you passed. So it's like,
I'm sure you will as well. We'll wait and see. Just a couple more weeks.
yeah.
I'm sure you'll
Well,
pass.
I don't know. I'm not getting my hopes up, but
Yeah, don't think about it.
yeah.
That's another very good piece of advice from me. Don't think about the exam. Don't think about the marks or anything until you get the result. That's the best thing to do. Just forget about it. Relax. Take some time
Mm,
off. Yeah. Do you feel like
yeah.
being from the UK sort of gave you an edge in the exam?
Um, I think it really helped me with my IPS
Mm,
because obviously your interactions are unnatural.
right.
I'm not saying that, if you're not from the UK, you can't have good IPS, but
Right.
you you're just more aware of how you're more aware of the way people do speak to each other in the UK as
Right.
opposed to another country. So
Right.
it's just I would say it's just that factor itself. But in the exam itself, because of the nerves, I feel like my IPS did suffer. I mean, I felt like there were
Right.
times when I wasn't really listening to their concerns or even perhaps reacting appropriately.
Hmm.
Uh, yeah,
I think so.
I
I think
think
you made a good point there. It does help because you know what to expect. So what I
it
did, I
does
think
help, but it's not a deal breaker. Like,
absolutely not. No, it's not a deal breaker for sure. There's
yeah.
so many people who have come there for the first time and they end up doing well in the exam. It's definitely
Yeah,
not
I mean,
not a deal
normally
breaker.
PLAB is for people who aren't from the UK, so it's
Exactly.
like,
There's so many
yeah,
people who
it's
pass,
just
and it's
not,
not a deal breaker. Uh,
yeah, so it's really not.
what I wanted to say
But
is there's a way that people can, IMGs who have never even been to the UK before, there's a way they can prepare. Um, and that would be just going and interacting with people. I know it's a bit more difficult because of COVID now, but you can go out and you can speak to people on the road from a distance and things like that. And that's what I ended up doing. So when I was there last Feb and March, I went out, in my free time. I went out, I went to pubs, I went out on the road. I started talking to people, interacting with them. So I had a very good idea of how to interact with people over there. And the same thing this time in December and in Jan. As I would just speak to people as much as possible because that's just naturally how I go about. That's just naturally who I am. I just like speaking to random people. So, and that worked out very well for me
yeah,
because my IPS was pretty good in the
well,
exam.
if you don't have that option, then there are GP videos, CSA exam videos
True.
online where
Right.
you can get an idea.
Right. If you're a bit shy about
Yeah.
speaking to strangers and stuff like that, you can definitely get an idea of it on YouTube too. That's a good point. Okay, well, I guess that sort of wraps it up. Thank you so much, and I'm sure many people
Yeah.
will have gotten a lot of useful information and tips and pointers from what you've told us about your exam experience, which was just a couple of days ago, right? So yes, thank you very much, Pranay. And
Thank you for having me, Nigel.
yeah, I'll be sure to update whoever is watching or whoever is interested
You're around.
when you get your exam result, which I'm sure you will pass. So yeah, I'll be sure to update people.
We'll see.
Okay.
Yeah.
Right. Talk to you soon. Thanks.
All right. Well, thank you.
So I hope this video was helpful to anybody who's watching. I hope you were able to learn something new from it and get some tips and tricks for the exam. And I also hope it made the whole exam process a little bit more transparent for you. If anybody has any questions or any more video ideas that they'd like to see, then definitely mention it in the comments and I'll try and make more content based on what you guys want to see. I'm going to be uploading more PLAB 2 related videos very soon. So just let me know if there's anything you guys would like to see. Also guys, if you know anybody preparing for PLAB 2, send them this video link and send them the link to the Telegram group so they'll have a better time preparing and they'll have access to more resources too. It'll also give me a better idea of what people are looking for in PLAB 2 videos and resources and things like that. So if you guys like this video, give it a like, share, and subscribe to my channel to keep up to date with future videos and future content as well. So goodbye everyone, and good luck with your exam preparation.